What just happened? Was it a car crash? You died, right? Car crash? Was it a plane crash? What is the number one cause of death in the US?
Sadly to say, heart disease is still the number one reason each and every American dies. 60s and 80s, it's no longer there. It is sadly, our age has gotten younger to get heart disease at this moment. So, yes.
Hi there, Rainbow Bestie. This is Alicia here with the Rainbow Band-Aid. I'm so excited to share what we have coming up today. But before we get into everything, I am going to go ahead and put my little disclaimer up. So the information that's provided in this video is for general information and educational purposes only. It does not constitute medical advice, diagnosis, or treatment. So always seek the advice of your physician or other qualified healthcare provider with any questions that you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something that you see in this video. So that's really important. And I have with me again over at Trident Heart and Vascular, and we are so excited because this month is February, and February is what, Dr. Vijayan? What is it?
It is Heart Health Month, and we raise awareness for everything heart related. Yes, we love heart.
Yeah.
We just love hearts. That's all I could say.
During this episode, we are going to be talking about prevention and why prevention is so important versus reactive heart care. What just happened? Was it a car crash? You died, right? Car crash? Was it a plane crash? What is the number one cause of death in the US?
So, sadly to say, heart disease is still the number one reason each and every American dies. Resources that we have in our hand, yet heart disease is still the number one disease to die from. Even during COVID, ultimately heart disease went under the radar, and 60s and 80s, it's no longer there. It is our age has gotten younger to get heart disease at this moment. So we need to do something preventative, and we are going to tell you all about it today and learn together.
Yes, I feel like a lot of deaths that come out are celebrity deaths, deaths that you hear in the news, these big crashes and things that are horrific, but we don't hear often about the daily deaths that happen. And I know in my family, there's been heart disease, stroke, heart attack. All of that happens more frequently than not. So it's really important to talk about, yes, all deaths are really important. We want to discuss everything, but the big one, February, of course, as well, Heart Month, what we can do to protect and preserve our heart.
For bringing me on the show again. And, we're both wearing, and we're twinning the t-shirt, Keep the Beat Heart Awareness Month. It is Go Red this Friday. Our daughters are going to be wearing red today. They are wearing red. They wanted to twin, and they want to raise awareness for mommies to have great heart health, and daddies too want to raise that attention for heart disease. My grandpa, he passed away. He just like the sound that he made, he dropped and he died, and it was a huge loss for my mom. She was the oldest, one of 6, was 16, and she had to carry the whole burden on herself. And we don't want that to be your family. We want you and your family to be healthy, happy, live a long, beautiful life. And these small measures, finding out can change things.
Right.
So let's help you make the change. Let's help you find your numbers. What does it mean to know your numbers? First of all, find out what your blood pressure is, what your glucose level is like, what your cholesterol numbers look like. How is your diet looking like? How much exercise are you doing every day? All of these things contribute to having a good heart health or a bad heart health. Can we change all of this overnight? No, it's not going to be possible. So I know you have a few tips on how we can do this.
So I know we all really like the convenience of takeout, Whataburger, McDonald's, Wendy's. All of those are really wonderful options when it's late and you're just trying to get home and getting done with a busy day. But those aren't always great for heart health because they're fried, they're greasy, they're fatty foods. There are some changes that even at those restaurants or fast food places that will overall impact our heart health. So swapping the fried for grilled I know at Chick-fil-A, they have those grilled chicken nuggets as options. So you can still eat at those places. You can still enjoy your life. You can still have a really good, healthy lifestyle.
And we hear from our patients is, hey, Dr. Neil, burger meal, instead of having soda, you told me to have a bottle of water instead.
Yes.
So an average soda has so much sodium in it, and that helps. Just swapping that out, it helps bring that blood pressure number down and keep it controlled. So you can still have your delicious burger, and it just so happens, life happens. We're so busy. We're trying to wear multiple hats all day long, and we need to feed that kid, and she's screaming and crying. She's hungry and hangry. We need to feed her something, yes. But we can swap that soda for a milk, a juice cart, or even just water. It's fine. Water is great. It's hydration.
Water is wonderful. So there are healthy alternatives, things that we can do. So we talked a little bit about diet. Other things that are healthy are incorporating, exercise, incorporating activity. So how do I incorporate activity? And then this is something that we were just talking about. I have an elevator that I take every day when I go to work. It's something that I have to do. Or I park really, really close because I don't want to walk all the way in. But what we're saying is small little changes like that are really big. What are some other ways that we can incorporate activity when you're busy?
That's a great question. In all honesty, I do that. I find the closest parking spot and I park.
Yes.
But it is an intentional change spot, parking there. So it allows our older population to take advantage of. So little selfless acts can go a long way. I think in February, again, Kindness Month, we want to do those kind acts, and we want to do it we're doing it for ourselves too. Climbing up at the beginning was hard for me just because, I hadn't done any exercise whatsoever. I was 2 flights of stairs. But I said, okay, you know what? It's the end of the day. I'm going to climb down instead. Well, I took the elevator in the morning. I'm going to climb down. And the other thing I decided was I sit at a desk and work all day, and I just get up. And it may look a little bit crazy, but I just say, okay, I'm going to walk around. And, instead of picking up the phone and intercomming my front desk suite person message that way, I just walk myself over to the front desk and say hi to her.
Little itty bitty steps that you take throughout the day add up miles.
It did. Right. And it was surprising. My calculator for steps, it showed that I had an increase of 1,000 steps this week just by doing that one small change. So that's all we want you to do. Say you're an active smoker. Smoking cessation is one of the most important things that you could do for your heart. Huge. But can you cold turkey it? It's not possible. You replace that habit with another one. So smoker, let's bring it down to 5. If you smoke 10 cigarettes a day, let's bring it down to 5 cigarettes a day. Then eventually there are ways like your PCP, Alicia here, she can help you swap that out for Nicorette. So there are ways how we can help you wean that off. You just need to talk to us. Don't be afraid to talk to us, because the more you talk and the more you learn, the more power you have to do good things for your heart. Other things that you can do is, we spoke about the salt, we spoke about the cigarette, we spoke about fried food that we all love, but there are ways, maybe we don't do it 3 meals a day. Maybe we can swap it out once a week. It could be a treat. It could be Friday, this is your fried food day. So whatever makes you happy. I know it's been a long week. Let's just let loose, go out for a drink. And another thing, drink in moderation. Instead of finishing that 1 bottle of wine, maybe have a glass of wine.
Yes.
Instead of 10 bottles of beer, maybe have 2. So watch out for that. Aspirin has also shown efficacies in reducing related issues. Talk to your cardiologist, talk to your primary care, see how you can get started on. Dr. Sharma actually wrote this beautiful article. He said, avoid smoking. Anything less than 130/80, he's happy with you. 2 steps. So he wants you to move a lot. Make sure you do at least 30 minutes a day, and 150 minutes of moderate intensity exercise. This is for a whole week. 150 minutes. Desirable weight. What does that mean? Anything a BMI of less than 25 is what American Heart Association recommends. Talk to Alicia. How can we reduce the risk factors like Are you at risk for prediabetes? Are you at risk for high cholesterolemia? What does your LDL look like? What does your good and bad cholesterol look like? Knowing your numbers. And you know what goes unnoticed? It's every single day we're so stressed, running here, running there, headless chicken every single day, and sleep. And you're worried. I am at fault for that too. At 1 o'clock at night, I'm running down my list. So we need to just compartmentalize and give that sleep the importance that it deserves, because sleep has also disease too. So all of these things, we are here. Dr. Chandra is here. Miss Alicia is here. We want to talk to you.
So thank you so much for sharing that. All that's really important information. I think it's so important that we collaborate as providers and patients to really break down that barrier, if you will, and create more of like a friendship, a partnering in communication. And I know that with Dr. Chandra, he's amazing and the collaboration is there. He talks to me like a friend. He's a friend, right? And you want that when you are seeing your cardiologist. And she is coming out with her own podcast. Yay! And it is called On the Beat with Julia. And I'll put the description for that on the post. I'll also put the description for Dr. Chandra on there. And if you like what we're doing, if you like what we're talking about preventative health in general, and then also expanding it outside of the heart, follow the Rainbow Project. Seek me out as a primary care provider on the Rainbow Band-Aid if that is something that you are excited about. And you can contact me. My number is 945-500-7425, 945-500-7425. So if that's something that you're interested in, we're happy to help and to be your collaborative team and to make sure that you are getting the help that you need. And have a wonderful Heart Month. Have a wonderful Friday.